What are KPIs?
Okay, KPIs are basically key performance indicators. Key performance indicators. Okay, so KPIs are basically data that are collected from various parts of the hospital. Each department has its own set of data, and by using the data, we analyze the data and we try to improve the performance set of that department. Okay, for example, you take a nursing department. There are various data that can be used to find out the quality of the nursing department. These are also called quality indicators. Okay, for example, uh, the number of infections in a nursing area, like central line associated bloodstream infection, okay, catheter associated urinary tract infection, surgical site infection, okay, then bed sores, okay, ventilator associated pneumonia. These are some of the nursing quality indicators. So we calculate the number of these events in the hospital, and that will indicate the performance of the department. Let us take another area like uh, clinical department, in doctors area especially. Okay, let us take the waiting time in front of the doctor's OP, door to nurse time, door to doctor's time, door to procedure time. Okay, these are various times that are calculated to see the performance of that area. We can even take financial KPIs, like capex, opex, operating cost, okay, operating margin, EBITDA, account payable, account receivable. These are financial KPIs. What do they mean? Like for example, capex is like the capital expenditure. Like when you start a hospital, when you start a department, when you buy an equipment, the initial cost involved with the capex. Like suppose you are buying an X-ray machine, maybe you spend several lakhs of rupees to buy the machine. Okay, that is capex. To run the machine, you need electricity, you need the infrastructure, you need staff. That is operating cost. Okay, to run the organization of hospital, we need some extra money for the running cost. So some money should always be available to run the organization. That is the operating margin. Okay, EBITDA shows the overall health of the organization, financial health of the organization. Account payable means the amount of money that you have to give to your suppliers, like pharmacy suppliers, equipment suppliers. You owe money to those suppliers, you have to pay them. Account receivable is the money that you have to get from maybe the insurance companies or other people who need to pay you the money. So this is the money coming in, this is the money you have to pay out. So there is a ratio between the money coming in, money paid. So these are the financial KPIs. These are the clinical KPIs. These are nursing KPIs. Apart from that, you can have an HR KPI. Like for example, attrition. Attrition means how many people are leaving your hospital, are not happy with their job. They want to go out of the hospital. They go for better opportunities. That is attrition. Okay. Then employee satisfaction. Employee satisfaction index. That is also an HR KPI. If your employees are not satisfied, they are happy, unhappy, they have union, they have strikes, then also that's an HR, serious HR issue, right? So we need to measure all these KPIs. After measuring all these KPIs, we prepare graph of all these KPI, and based on this graph, we take action. Okay, if this is going beyond a certain level, then we need to do the corrective action. We need to do a root cause analysis of the problem. We need to sit down as a team, and we have to find out solutions, and we have to correct this and bring it to the required standard level. Okay, so the KPIs are basically that data we collect from different part of the hospital. After collecting the data, we prepare a graph of this data, and we study the graph, and we take action depending upon how the graph is going. Okay, ideally the hospital information system, HIS, if the hospital has got a very good HIS, all the KPIs can be available in the hospital information system. And from this hospital information system, we can create a dashboard. And this dashboard will give you a live report of all the activities that is going on in the hospital. KPIs are basically used by the operations team and the management to assess the overall performance of the hospital. By viewing the dashboard, if you have a good HIS, you can have a live dashboard. If you have a live dashboard, you can get a real-time assessment of all the activities in the hospital. So all the data that are coming will come on the screen, and by looking at the screen, you can know which department is performing in which level, right? And on basis of this, we can take action and we can correct it to bring it to the best level. Okay.